So let's talk about emergency contraception. Now, emergency contraception is divided basically into two forms. One would be hormonal, and other would be IUCDIs and copper-containing devices. So now these are the major ones, most commonly used. So the hormonal ones are basically divided into two types. Uh, two types. So the first one is levonorgestrel, and the other one is ulipristal. So levonorgestrel is basically a large dose of levonorgestrel. So it's 1.5 milligram. Important to remember, if the BMI of the lady is larger, i.e. if it's more than 26, then the dose has to be doubled. And this is used as most common form of hormonal contraception. The problem with this is the side effects. The side effects is nausea, vomiting, and erratic periods up to 1 week. The good part is it can be used again in a cycle, but it is not a continuous form of contraception. So it should be only used when you have an unprotected sexual intercourse. The interesting part is that you can take it up to 72 hours after an act of unprotected sexual intercourse. Coming to ulipristal. Ulipristal is a prostogen receptor modulator, simply called PRM. Now, because of the mode of action, it does interfere with some of the progestogen containing contraceptive. So it's advised that you take at least 5 days of additional contraceptive cover, for example, usually condoms. Now, the good thing about this, it has a longer coverage. So for example, levonorgestrel is used only for 72 hours, but ulipristal can be used for up to 120 hours, i.e. 5 days, which is good. Important thing is to remember is that it is excreted in breast milk. So if you are lactating, then do not take it. It can also be problematic in asthmatics. So asthmatics are advised to stay away from it. It cannot be used again in a cycle, so it can be used only once in a cycle. So these are the common things about hormonal contraceptives. Coming to copper containing, the IUCD, it can again be used up to 5 days. It's very effective. The failure rate is less than 1%. The mode of action is simple. It's toxic environment for fertilization, and copper can also be toxic to the sperms. So there we go. It's simple. Different types of emergency contraception. Summarizing, so we have hormonal divided into levonorgestrel and ulipristal, and then we have got our IUCDs, copper containing. Thank you.